Hello, and welcome to the PCOS Fertility Health Podcast. I am your host, Dr. Angela Potter. I am an integrative PCOS fertility doctor helping women like yourself to understand the root cause of your fertility struggles and turn those around. And I am super excited to have you here today. We are talking about signs of ovulation after stopping the pill. The pill is used very commonly with PCOS, so I'm guessing that it has been a part of your journey at some point. We're going to dive into what does ovulation look like after you've stopped taking the pill. Before we get into that, I want to make sure that you have your free gift that I have put together for you. That is the PCOS fertility checklist. It is a very streamlined, very clear list of things that you need to have in place in order to know that you have this holistic plan that's addressing your body and helping you get to the root cause of your fertility struggles. So if you haven't picked that up yet, then go ahead and grab yours at drangelapotter.com/checklist. Be sure to subscribe here so that you stay updated on the upcoming PCOS fertility episodes. If you want to be turning around your irregular cycles, if you want to be improving ovulation naturally, and to get to that root cause of what's keeping you from getting pregnant, then subscribing here and staying updated on the new episodes is going to be really important for you. And I just want to acknowledge you for showing up here today. I think it is so cool that you are putting the time into listening to something that is going to help move your fertility forward. There are millions of podcast episodes out there, but you are choosing to listen to this one. And that speaks very highly about who you are as a person. And it speaks very highly of your commitment to your health, to your fertility, and to growing your future family. And by being here in this community, you are joining a very cool group of women who are dynamic and fun and committed to changing their health and their fertility in a positive way. And you're here because you've been trying to get pregnant for the past few years, 6 years, and you have been on birth control and you have been to a doctor who told you, well, your labs look fine, everything looks fine, we don't know what else to do for you. You have gone to an IVF center and you have done that preliminary appointment, getting your body ready for IVF. And you're just thinking, but this doesn't feel right to me. If my labs are fine, why do I still have irregular periods? Why am I not ovulating? Why have I not gotten pregnant? And you want to be doing the work to understand why your body is not having irregular cycles, why you're not able to get pregnant. And you want to turn that around naturally so that your body is working as it's supposed to be, so that you know that you're healthy, so that you can move forward to a healthy pregnancy and have a healthy baby. That's what you want. I mean, yes, you see pregnancy in your future, but you're a little nervous if you were to get pregnant right now. Because with your irregular cycles, with your hormone imbalances, you're wondering, can I actually hold a pregnancy? I want to make sure that I am at my healthiest once I get pregnant, so then I can have a healthy pregnancy and have a healthy baby. So if that's you, you are in exactly the right place. And I am just really excited to have you here in this community. And today we are jumping into this topic about what does ovulation look like after stopping the pill. Here's why this is so important for PCOS is that the pill is the number one most recommended treatment for irregular cycles with PCOS. It is the top recommendation for turning around irregular cycles when you're working with a doctor who doesn't look at that holistic look at your health, and they're not taking that extra step to understand, well, why is it that your body is set up for irregular periods in the first place? Not all doctors prescribe the pill for irregular periods. I don't, but it's really important to talk about the pill and coming off of the pill because so many women, yourself probably included, have been on it at some point. So let's talk about ovulation after stopping the pill. Ovulation can start anywhere from that first month after getting off the pill up to about 6 months. Usually that's the timeline that us doctors tell you, yeah, that's a reasonable expectation. Your body might take an extra few months to start ovulating naturally. I will tell you that it's not uncommon for you to have years post pill and still not know if you're ovulating naturally when you have PCOS. So if you're in that place, you're not alone. I will tell you that I hear that very frequently in my practice. You're not alone and you haven't done anything wrong. There are ways to turn that around. But I want you to know that even if your doctor told you, well, it could be about 6 months after the pill, and now here you are, it's been 5 years, you are doing the right steps right now to help uncover why your body is still not ovulating post pill for so many years. What does ovulation look like post pill? Well, it's honestly going to look really similar to ovulation pre pill or ovulation if you haven't been on the pill. So, when your body ovulates, we have some pretty typical symptoms. Not everyone has these symptoms. You do want to have a couple of these symptoms, but being on the pill doesn't necessarily change your ovulation symptoms. It doesn't bring on new symptoms that aren't common ovulation symptoms before the pill or if you haven't been on the pill at all. Let's talk about what those ovulation signs and symptoms are. One of the classic ones is increase in cervical mucus. Even if you don't see a big increase in the amount of cervical mucus, you might just notice that things are a little slicker, is a little more thicker. Even if you don't notice like a big increase, that's okay. I talk to a lot of women who are worried that they don't have this big increase mid-month around ovulation, and that's okay. As long as you're noticing that it has a different consistency, that's more important for ovulation than an increase in the amount. You might have a little bit of abdominal cramping, like cramping in your lower belly, maybe on one side, because when you ovulate, you're ovulating just on from one ovary, and you have one ovary on each side of your pelvis. You might have a little breast tenderness, and that's a sign that your hormones are changing. Maybe you are charting your temperature. You're using your basal body temperature, and around mid-cycle, you are getting a temperature increase, and that is an indicator of ovulation. Maybe you're using ovulation predictor kits, right? Those strips that you can buy at the pharmacy or the store, and you test, you're getting a positive LH on those strips. Those are going to be the classic ovulation signs. Your cervical mucus may or may not change, right? Or you may not be able to really tell the change of that. It's okay if you don't get a little pelvic cramping. It's okay if you don't get breast tenderness. And as we talked about, it's okay if you don't see that big increase in cervical mucus, and maybe you don't quite understand that change in consistency, and you're not able to identify that yet. If you are somebody who's tracking your temperature or using ovulation predictor kits, you do want to be seeing that shift in your temperature or getting those positive signs for ovulation. When you're tracking your temperature, you're tracking your temperature every day. And so you'll be able to see that shift if and when it happens during the cycle. Your ovulation might not happen on day 14. That is the classic. Now I'm using quotation marks here. If you're listening to this, not watching it on video, that's the classic time of when ovulation happens, but it could happen a couple days before. It could happen a few days after. And so if you're using those ovulation predictor kits, the OPK strips, as the only indicator of ovulation and you're not getting a positive, you might be missing that ovulation window. Let's talk about it this way. What are signs that you aren't ovulating post-pill? Well, you aren't seeing any increase in cervical mucus. You aren't noticing any change in that consistency of your cervical mucus. Now, we talked about just a minute ago about how it could be normal that you don't have a huge increase in cervical mucus. And so that isn't necessarily something that will automatically tell you, well, I'm not ovulating. But if you don't have that increase and you don't have that cervical mucus consistency change, along with a few other things that we're about to talk about, then you're going to want to be thinking, well, maybe I'm not ovulating. If you're tracking your basal body temperature every day, you're not seeing a rise in your temperature. That's an indication that you are not ovulating. You aren't getting any positive LH strips. Again, we did talk about how you could miss that ovulation window. And so that may or may not be a marker of ovulation. But if you've been using ovulation strips for the past 6 years, there's a chance that you would have figured out ovulation by now. You would have at least gotten one or a couple positive. And then one of the strongest indicators that you aren't ovulating post pill is that your periods are long. I mean, they're like 45 days or more. Or maybe you only can have a period on a medicated cycle. Maybe you only have a bleed once a year. Maybe your cycles are really irregular. So they're long. Maybe one's 45 days, maybe one's 60 days, maybe once every 3 months. And they're just all over the place, but they're still really long. Those are all indications that your body isn't ovulating. This is a good point to also bring up the fact that if your periods are a few days later than 28 days, you could still very well be ovulating. Okay, we talk about this 28-day cycle as the gold standard of a cycle length for women. It's not every single woman has a 28-day cycle. You could have a 35-day cycle and still be ovulating, still be really fertile. I talk to women about this all the time. They talk to me, they're so worried that their periods are a few days late after 28 days. But then when we get into the details, I ask them about mid-cycle changes. They're saying, yes, I'm having an increase in cervical mucus. Yes, I'm noticing a change in my temperature. I've done ovulation strips. Those are positive. But I'm worried because I have a 35-day cycle. Sure, we want to look at progesterone levels and make sure that the hormones are doing what they're supposed to be doing, but that is a really fertile cycle right there, even though it's not 28 days. So when you have a long cycle or an irregular cycle, we're talking usually like 45 days or more. Now you know the signs and symptoms of ovulation after you've stopped taking the pill. You know what it looks like when you aren't ovulating post pill. And you were most likely told that you would start ovulating naturally between 1 and 6 months post pill. If you are in that 6 month period and you still want to be proactive about supporting your ovulation because you already know that you have PCOS, you don't want to be waiting those 6 months before you're like, oh, now I've waited 6 months and I'm still not ovulating. You can absolutely be supporting your reproductive hormones, your ovulation in that 6 month window. Absolutely. If you have been off the pill for 6 months or more and you still aren't getting any one of those ovulation signs, then it is time to do something about it. It is time to figure out why you aren't ovulating, why your body still has irregular periods, okay? If your goal is pregnancy, then now is the time to take that next step to understand why my body is not ovulating still. And again, I will tell you that you are not alone. Even if it's been years since you've been off the pill and you still aren't ovulating, still aren't having regular periods, you aren't alone. And if it has been years that you're not ovulating and you've been off the pill for this long, there is something that you can do about it. It's not like because it's been this long that there's no hope. No, absolutely. You got to get that clarity, identify what's going on in your body that's keeping you in this place and turning things around. Here's something else that happens. Women get off of the pill, and that's when their irregular cycles start. Before going on the pill, their cycles were regular, like to the moment. And then they get on the pill and they come off the pill, and all of a sudden, cycles are all over the place. That's when their acne starts, that's when their facial hair starts growing, and that's when they start gaining weight. And it just sits there on their body. If that is you, you are not alone. And it is not in your head if you're thinking, wait, did the pill change things for me? Like I was told that was, it was fine and it was going to be an answer for me. And now all of a sudden I'm having all these symptoms. Is it just me? Is my body broken? It is not just you. I hear these stories almost every single day. It is not in your head. Now, here's the thing. I'm a functional medicine doctor, so I use natural treatments. I use supplements, nutrition as the main focus of my treatments. I use medications here and there. I'm also not anti-medication. They absolutely have their place. The pill has its place. But when the pill is being used to regulate periods for PCOS, I don't like to use it. And the reason I don't like to use it is because it's a band-aid solution for what's going on. So if you have PCOS, you have irregular periods, and you're told, well, take the pill, this is going to fix your periods. Number one, when you're on the pill, your period is going to look really beautiful. And, you start taking it, 28 days later, you're going to get a bleed. It might be, it's really easy, not a lot of PMS. And then 28 days after that, another, easy bleed. And you're just like, yes, this is so great. I did it. My body is doing it. It's showing that it's regular again. That's exactly why it's a band-aid solution, because what's going on internally is different from what you're seeing externally. So those symptoms, that bleed every 28 days, makes you think, yes, my body's doing it. But what's happening inside is that when you take the pill, it's just shutting down your body's own production of progesterone and estrogen. It's basically saying, hey, body, like I've got this taken care of. You can take a step back. I am going to put the hormones into the body. And so your body, you could test your blood levels of these hormones and they would be low because your body is not producing them while you're on the pill. That is the number one reason why I don't like using it for regulating periods for people like yourself with PCOS, because it is not addressing that underlying issue of why you have irregular periods, why you haven't been ovulating, why you have PCOS. So when I am working with patients and clients, that's what I'm helping them with, is to get to that root cause of what's going on. What's keeping them in this place of having irregular periods and not being able to ovulate in the first place. And I also want to say that if you've already been on the pill, that's been a part of your PCOS journey, I don't want you to think, oh my gosh, why did I do that to myself? That was a really bad decision to make. No, absolutely not. We all make decisions based on the information that we have in that given moment. It's not like, all right, you've been on the pill for a few months or a few years, that you can't do anything about it once you're off it to then help your body to come back to a place of balance, to get your hormones back to a place of balance, to bring back ovulation. You absolutely can. It reminds me of someone that I've worked with who shared her story here on this podcast, Taylor, who she was on birth control pills and years later was still not having regular periods and positive ovulation all the time. Well, we worked on addressing what was coming up for her, and she got pregnant, and she now has her beautiful baby with her. And so it is possible to turn these things around. And the fact that you are showing up here, that you are continuing to seek out information and answers about your own body, you keep searching, you're going to find what you're looking for. And if you need help with that, if you are saying, yes, I need to turn these things around, I want to be doing this naturally, I want to get to that root cause of why my body's keeping me stuck, not ovulating, not having regular cycles, then I am your doctor. You can sign up for a free PCOS fertility breakthrough session. And that's a call where you and I are going to talk about, well, what's going on with your unique fertility struggles? What's been going on over the past few years? What has that looked like for you? And then I'm going to help you figure out, okay, this is what you've done. These are the things that are keeping you stuck. These are the missing links that have been keeping you in this place of still having irregular periods and not being able to ovulate. And this is the single most important next step that you can take in order to start turning that around. So, if that's something that you're looking for to start getting to that root cause of your fertility struggles, then you sign up at drangelapotter.com/PCOS. A calendar will pop up there. You just choose a time and a date that works best for your schedule, and I'll give you a call. I will help you start turning around your fertility so that you can see that your body has the potential to be a success story. As a reminder, as we wrap up here today, this information is for just that, informational purposes only. It should not replace the advice that you are currently getting from your doctor. And if nobody has told you this before, I want to be the one to tell you that I believe in you. I believe in your ability to find that root cause of what's keeping you stuck and to turn that around so that you have the very best chance at getting pregnant with PCOS. I'll see you right back here next Wednesday.